Hey, Dr. Max here. Well, I just wanted to take a moment to share the results of this GI map, which is a type of stool test that I recently did on a patient who is 5 years old. This is a little girl who's been complaining of gut pain to her parents for a really long time, and they finally brought her in to work with me. And I wanted to share this with you because I think this is a great example of why it's so important to do something like a stool test. So the GI map is a pretty good one because it does a PCR analysis, a DNA analysis of all sorts of different microbes and critters in the digestive tract. And it gives you a really good overview of potential causes of inflammation or gut pain. Now you can see right here at the top, pathogens. Boom, well, we already have a positive for one, a type of E. coli that is known to cause stomach cramping, nausea, changes in bowel movements. So this person had food poisoning, right? So no wonder her tummy hurt. If you continue going on down here, they test for H. pylori, which is a very common microorganism found in the digestive tract, especially the stomach. When H. pylori overgrows, it can lead to things like not producing enough stomach acid or sometimes producing too much. And when this one overgrows, it can be a major problem. If you're not producing enough stomach acid, you're not digesting food properly, which means you're not making enough B12, you're not sterilizing the contents of your stomach. You're going to have a more difficult time breaking down food, proteins, carbs, fats. You won't be absorbing as many minerals and vitamins because you're not digesting properly. You can see here they don't consider this a positive result, but it is getting close in terms of the H. pylori. So this could be playing a role in why the stomach is dysfunctional in addition to the food poisoning. And we come down here, we see commensal or keystone bacteria. So these are bacteria that are generally very helpful for digestion and for gut health. If they're overgrowing, like the Enterococcus species here, or if they're not in enough abundance, there can be an imbalance in the microbiome. Keystone in that they're usually serving a beneficial function and found in a lot of healthy microbiomes of people with a nice healthy gut and a large diversity of microorganisms in there. Enterococcus, when that one overgrows, it can create symptoms of bloat or irritable bowel, which is changes in regularity and can be related to gas and abdominal pain, which this patient certainly has. We come down here, they do general bacterial phyla, which I like to think of as, broader families of microorganisms. There are different types. The Firmicutes here, which is really overgrown, is known to create symptoms of gas, bloat, changes in bowel movements, nausea, and a sense of fullness. This 5-year-old was always talking about how she was never hungry, and then she would get really hungry. So she would have small meals and then feel really full. This one is, classically associated with small intestinal bacterial overgrowth or SIBO. We come down here and we look into opportunistic overgrowths. Boom, 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 all sorts of positives. These are ones that, if are given the chance, can overgrow and create problems. See a variety of different types here, some of which, may be found in probiotics. So if you're taking probiotics with a lot of bacillus species and you're getting overgrowth here, maybe you need to cut back on the probiotic, or maybe you need to work on improving your diversity of the microbiome, taking different types of probiotics, or working on a better balancing protocol so the gut's not so dysfunctional. In terms of things that are overgrown here that are a problem, commensal overgrowth, the methane producing family here, overgrown, classically associated with the type of SIBO that produces a lot of gas, bloating, and constipation. This one is notoriously difficult to treat, the methane dominant kind, and often requires a period of treatment over several months to, fully eradicate that or to improve it enough that the bowels change in a significant way. Sometimes people may even require, prescription antibiotics that are really strong to wipe out some of these things. You can see that this 5-year-old girl also has some species that are overgrown that are associated with inflammatory conditions, autoimmune conditions. In the case of Klebsiella here, that is associated with UTIs. This 5-year-old girl often complains about pain in her groin and has a history of multiple UTIs. This one's also associated with SIBO, small intestinal bacterial overgrowth, and having issues with histamine, so producing too much histamine, which can be related to allergies, parasitic infections, food intolerance. The Proteus species down here, this is associated with symptoms of bloat, gut pain, gas, diarrhea, and bowel changes, as well as a sense of fullness. When it comes to the yeast and fungi, she didn't have candida overgrowth, which is nice to be able to rule that out. No cytomegalovirus or Epstein-Barr virus. Some common things that can cause major issues in the gut. No parasites were present, at least none that they were able to detect, so that is positive. But then when we come down here and look at some intestinal health markers, steatocrit, that's, fat in the stool, pretty good. Elastase 1, this is a marker of how well the body is making digestive enzymes. So when this is moderate or low, not in the ideal range, this person, this 5-year-old girl, maybe is not producing enough digestive enzymes in her pancreas or is not making enough stomach acid to properly digest things. And we know that she already had food poisoning from the E. coli, and the H. pylori could be playing a role with that. Other things that were high, secretory IgA, this is an antibody released by immune cells in the gut, incredibly high, so we know that there's some active inflammation going on in her gut, probably something that the body is trying to fight off. We can see that she's borderline high in anti-gliadin antibodies. This is something that the body can produce in response to gliadin, which is a protein found in certain grains with gluten in them. So this person may be borderline gluten intolerant. We can see the gluten peptide down here is higher than we like to see. We like to see that pretty low. The eosinophil activation protein, boom, incredibly high. That's associated with allergies, parasitic infections, some bacterial and viral infections. We know she's got a lot going on, some overgrowths. She's got food poisoning. It can be associated with inflammatory bowel disease, Crohn's and colitis, which is why we also want to check something like calprotectin, which is a marker of inflammation. When you add all these clues together, it can help determine whether someone is dealing with IBS or inflammatory bowel disease, Crohn's and colitis, or something else like an infection right here. So we know she has food poisoning. We know that she has multiple overgrowths, opportunistic, things that are associated with inflammation. It seemed like no parasites, no viruses, no fungus, at least not the ones that we checked here. But a few days after this patient submitted this stool sample, then parents reported that she had pinworms in her stool. Like straight up. I hope that's not TMI for anybody, but we are talking about stool testing here. Very important. So this patient did have a parasitic infection. So no wonder she was dealing with lots of gut pain, fullness, always complaining that her tummy hurt, getting multiple UTIs. This all makes sense. Last thing they do is they also check for antibiotic resistance genes to see if you're going to have a problem with H. pylori and you'll need, triple or quad antibiotic therapy if that's going to be especially difficult for you given your genes. So you can see why the GI map is such a nice overview for a variety of different gut issues and can be really helpful and give you more actionable information about how to move forward and treat this person. So I just wanted to share this one because I thought this was a great example. This 5-year-old was complaining about gut pain for a long time. Her tummy was always hurting, sense of fullness, history of multiple UTIs. And then a couple days after this stool test, we have pinworms. So a variety of different things that I'm going to be working on with this person and her family. We're going to be working on, getting obviously the pinworm medicine right away. We're going to be working on trying to kill off some of these overgrowths and rebalance the microbiome with some of the more beneficial species so that there's not only overgrowth, but we still get lots of abundance and we can calm down some of these markers of inflammation. Obviously, since she's getting close to producing a lot of inflammation in response to gluten and gliadin, we also want to cut down on the gluten-containing grains she's eating right now so that as we resolve these infections, calm down markers of inflammation, markers of infection, we also support the gut lining so that we don't develop food intolerances. When you have an inflamed gut and you start reacting to things like gliadin, dairy, normal things that are going through the gut, if you don't address the inflammation in the gut, and try to heal and seal up the lining of the intestine, then this can lead to things like food intolerance, food allergy, or even lead to autoimmune conditions because when the gut is really inflamed, it degrades the lining of the gut, and suddenly you can develop these holes in the gut, intestinal permeability, leaky gut, which leads to the immune system in your body, most of which is in your gut, responding to all sorts of things it wouldn't normally, like foods, like gluten, um, like normal bacteria. And if anything, if any of the proteins, any of the tissues in the body happen to resemble those things close enough, then you can develop an autoimmune condition. For example, some proteins found in parts of the brain and the thyroid can look very similar to gluten or gliadin and casein proteins in dairy. And so if your body becomes intolerant to those, you're at a higher risk of developing something like an autoimmune thyroid disease. So I was really grateful that this 5-year-old's parents were able to work with me and do this stool test because you can see we got a lot of things to work on. All right. I hope that wasn't too much. Um, and thank you for listening.